Good evening. I'm Mayor Ron Nirenberg with Bexar County Judge Nelson WOLFF, and tonight we're joined by Dr. SANDRA GUERRA, who is the Assistant Director of San Antonio Metro Health, and this is our COVID-19 update for the San Antonio community. We are still converting to Texas Health Trace, an online data management system at the state of Texas, and we are still waiting for some data to be converted and sent back to us from the state. So the numbers, again, are a little bit lower, and we're hoping those are going to be in full tomorrow, but we will report to you when that conversion is complete at the state. But tonight we are reporting 136 new cases of COVID-19, which brings our total currently to 41,274 in our community since the pandemic began. So this is the bottom line as you see these numbers, because they are starting to trend in the right direction. You have to stay vigilant. We all have to stay vigilant. We have to keep our guard up. We are getting very close to Labor Day, and we're getting closer to schools opening, and we've got to do everything we can to bring that infection rate down, which currently stands positivity rate around 14 to 15%. So we are nowhere near where we need to be in order for all of us to get back to some of those activities that we've been enjoying. So please stay vigilant. COVID-19 is still in our community, and if we keep up mask wearing and physical distancing, we will avoid another spike of cases. And we saw a very deadly June and July because of the spike in cases that occurred the last time things started to improve. Over in the other data, we do have to report. We are starting to get some of that death rate data back from the state as well, and we have 10 deaths to report tonight, bringing the total to 380 since this began. These deaths occurred between April 26th and August 2nd, but we, again, these were data recently reported to Metro Health. Let me go through them demographically. We do have one male in his 40s, and I do want to note here that roughly 10% of fatalities in our community are now of folks in their 40s and below. 2 Hispanic females in their 60s, 4 Hispanic males, 1 in his 40s, 2 in their 50s, and 1 in his 90s, and 3 white males in their 60s, 70s, and 90s. And please remember, each of these deaths is not a number. This is a loved one lost, a neighbor, a friend, an uncle, an aunt, a father, a mother, a son, or a daughter. Please keep them and their families in your prayers. Tonight over in our hospitals, things are starting to ease up a bit. We are reporting 838 people in the hospital, down 48 from yesterday. 336 are in the ICU, which is down 14 from yesterday, and 238 on ventilators, down 4 from yesterday. 50% of our ventilator capacity and 17% of our staffed hospital bed capacity are available. And those numbers are improving, but our hospital system remains under severe stress, with 23% of all admissions accounted for as COVID-19 admissions. And keep in mind, our hospital system is also a regional system, so stress experienced in any part of our system, whether it's in a rural area or right here in the urban heart of San Antonio, contributes to that stress level, and we've got to manage it by staying, again, physically distanced, wearing masks, and doing our best to slow the spread of this virus. So let me turn it over now to Judge WOLFF.
Yeah, well, thank you, Mayor. And I know there's some still missing data with respect to some of the tests, still some differences between our numbers and the state numbers on deaths. But what I pay the most attention to is the hospitalization. We are down to 838 now, and that's from a high of 1,267. So we're really making some really strong progress there, and the reason we are is because of what you're doing. I mentioned to the mayor earlier today, I said I was out at La Cantera Mall on Saturday, and I was at H-E-B Elan on Sunday, and 10 different people stopped me, different groups, and every one of them was appreciative of the show we're doing and the information they're getting, and every one of them is being very cautious, wearing their face mask. Even with their own families, they're being cautious about it, particularly when someone from their family member may come to their home and never been there before. They're not quite sure. So I think the reason we're doing good or doing better is simply because people are really paying attention and really taking care of themselves and trying to help everybody else at the same time. But as the mayor said, we've really got to keep that up. We can't let our guard down. We know what happened last time. We had a huge explosion of cases and many, many deaths and many, many people seriously ill in the hospital. So we've got to keep it up. And that means as we come in to the flu season, we're going to have to continue to be very, very cautious because we'll have two things coming at us then. And if you got a flu shot, it's very important to do that. I think usually we get them in September, I think. But getting that flu shot and continuing to wear the mask will help us not only with the COVID, but if we can slow down the spread of flu, that's going to save a lot of people also. So let's continue to be safety and let's continue to go. At the same time, I'm sure you read about it too, but the vaccine is continue to move forward. Over 160 different possible vaccines, 14 of them very promising, 3 of them in the lead. Oxford University, Moderna, and Casino, a Chinese company, are sort of in the lead now, moving forward. But even with that, let's just say we do get a vaccine by the first of the year, we can't expect it to be a miracle. We don't know for sure how it's going to work. Hopefully it will help stop the spread of COVID. That'll stop people from getting seriously ill. They still may get it, but stop them from getting seriously ill. And we really don't know, once you get that vaccine, how long it will last and how long it will take care of you. So even with that on the horizon, we've just got to adopt a way of living together by using the face mask, keeping the social distance, using sanitation, trying to stay away from larger groupings. So we still got our work cut out till we really, really find out how effective a shot vaccine might be, and that won't be till the first of the year.
Right. Thank you, Judge. And as a reminder, again, also keep it within the family unit. If you're going to work and you're having lunch at work, stay out of the break rooms. Try to keep distance there as well. And also, we've got to refrain from these extended family gatherings. And if you do, make sure you're physically distanced and wearing masks. A reminder that tomorrow evening we'll be hosting a virtual town hall meeting regarding COVID-19 in schools. And the meeting will feature live audience polling and opportunities to ask your questions. And you can be part of that conversation tomorrow at 7 p.m. right here on TVSA. And as always, you can subscribe to the latest COVID-19 updates by texting COSA-GOV to 55000 or going to the website anytime at covid19.sanantonio.gov. Wear your mask, physical distance, and stay home when you can. We'll save lives together as we get closer to the fall. We've got Dr. GUERRA here and myself and the judge available to answer questions.
I'm wondering if you're all expecting, or if you're told in advance if there's a backlog in tests, or as we're waiting for everything to be put into the new system, if tomorrow or the next day there's going to be a pretty significant spike, or what should we expect?
Well, maybe Dr. GUERRA can describe it better, but there is data that's being converted right now that is from Monday and Tuesday that we'd normally be reporting to you right now that is going to be part of the update as soon as they're done converting. So there will be an adjustment. The size of that we don't really know.
That is correct. So it also is something that those diagnoses may have occurred already, or those test results have come back, but they will be inserted into the system. They are being collected. It's just a matter of reporting out, hopefully tomorrow, in the very near future, though.
Earlier today, the governor said that he has been supportive of local health departments giving advice to school districts, and I'm just wondering if that's how you've all felt going through this process with the state, that he hopes that people will listen to the Public Health Authority and that he has consistently felt that way, and that it's been fairly obvious that he's felt that way. Is that how officials have seen that?
You want to go first? Go ahead.
Well, sure. We've never felt that our community, especially our school districts, took the words of our Public Health Authority lightly. We hope they follow those directions. The question is, though, over a community as diverse as ours, with 17 some odd districts and a lot of different voices at the table with regard to school boards, teachers, students, and parents, whether or not it will all come down to the public health directives and the public health guidance. That's what it should, to keep our families safe, and that's what the judge and I have wanted from the start.
We don't know. I mean, they don't have to follow our advice when they decide to open. Obviously, the mayor and I felt that public health should determine when the opening should occur, but we were overruled on that. So each school board is going to have to live with their own decision. We know that the major ones here, I believe Northside, San Antonio, I believe Northeast, are going to wait till September the 7th, which is what we thought was the smartest thing to do, because we still don't have this under control. So they're going to, who knows what these different school boards will do. But we do have a handle that if something goes wrong, maybe I explained this wrong, but if something goes wrong, the public health director can step in there and take what action is necessary if an outbreak does occur in school. And you can almost bet somebody's going to have COVID there.
Yeah.
And we've seen it across the country already. So we do have the right to step in and take action.
Yeah, and I think what you'll find tomorrow when Dr. Wu and the coalition get together and the town hall happens, you're going to see those metrics that we should hit as a community before schools should safely open in person. And so, my feeling is that, we shouldn't have to wait for the horse to be out of the barn for us to control this virus. We saw what happened when things got out of control in May and June. So let's keep an outbreak from happening. Let's keep people from getting sick rather than waiting for it to happen. And we hope that the districts, the superintendents who have all been very proactive will do that on behalf of their communities that they serve.
We have a text question from Brian Chasnoff of the Express News. What are the circumstances in which a death certificate lists COVID-19 as a cause of death, but Metro Health later determines that that was not the case?
Okay.
Yeah, I'll try and take that. So obviously, a death certificate is something that in the state of Texas is completed by the attending physician at the time of death. And so they will take the information that they have available to them to their best of their knowledge to make the cause of death appear on a death certificate. That certificate is then transferred to the state, and that information is collected. I will not try to second guess all those different well-intentioned clinicians out in our state that are doing the very best that they can for a diagnosis that is at their best of their ability. For many of these clinicians, these patients are coming at them, never having met them before, not having a lot of background in history, and making a clinical diagnosis based on the presentation that they have. The idea that the end-all be-all is always the test is something that as doctors, we were trained very early on that our diagnosis is based on the complete clinical picture. That also occurs for clinicians that are trying to do their best in completing a death certificate for a patient. So that really is something that I think at the end of the day is recognizing that people are doing their absolute best in a very tough situation.
So even if a person had not had a COVID-19 test from a healthcare provider and they go to the medical examiner's office, if they had symptoms of COVID-19, they would be tested post-mortem. That's correct, right?
That is my understanding, yes, ma'am.
And so anyone would be, so regardless of whether the symptoms or, they would be said to have it later on. Like, we should be figuring that out later. That's correct?
I don't know that I can answer that correctly for you. I am not sure that every single death is having to go through a confirmation through the medical examiner. So that is something we can try and get that answer for you later.
Thank you.
All right. Thanks, y'all.
Thank you.